So, thanks for the introduction, Riccardo. So, I'm Sotiris. I'm the director of the HEAL Network, the Health Environments and Lives Network, funded by NHMRC, that's the Environmental Change and Human Health Initiative. You can see many co-authors here. Some are in the room, Melissa in the back, and Nigel, Riccardo, and Shamila, who's earlier with us in this session. So the focus of the network is to improve environmental health and address challenges related to extreme events, climate change, but also adapt to environmental change and identify solutions that can provide multiple benefits for health and well-being. Next slide, please. I can do that.
Yeah.
I would like to acknowledge the traditional custodians of the lands we're based at. I live and work in the Union Country in Canberra, and I would like to pay my respects to the many Indigenous collaborators and members of the network, and acknowledge their knowledge and wisdom, which is the cornerstone of the HEAL network. And the Indigenous collaborators and the First Nations of Australia and internationally have adapted to environmental change for many thousands of years. So there's a lot of wisdom and knowledge to transfer and integrate with Western science in the effort to adapt to climate change and environmental change. Some of these environmental changes can be very dramatic, as you can see here, extreme events that we experienced in Australia in recent years, from heat waves to droughts to bushfires and more recently floods. So the HEAL network is aiming to address the impacts of those extreme events, but also address the impacts of more slow-burning issues like air quality, air pollution in cities, the overheating of cities, and this both can have an impact on health, physical health, mental health, labor productivity, which is a number of presentations in this conference quantifying those impacts. And also, an important aspect of the HEAL network is to identify and promote effective solutions. So we're not only identifying the impacts, we are working to identify and evaluate the effectiveness of interventions, which can be in the built environment, as you can see here, active travel, infrastructure, which can increase physical activity, improve cardiovascular health, and at the same time reduce greenhouse gas emissions and air pollutant emissions in the atmosphere. Same here with the electrification of the vehicle fleet, reducing air pollution and also greenhouse gas emissions. Healthier diets, which reduce emissions of greenhouse gases from agriculture and farming, and improve health, and also household energy, solar, rooftop solar, which reduces emissions to the environment, greenhouse gas and pollutants, and also provides opportunities to improve thermal comfort in our houses. Similar here, green space is a key aspect of the network, looking at the quality and distribution of green spaces, which can provide multiple opportunities for health and well-being and amenity, and also importantly strengthening primary care and public health in our communities. So the HEAL network is a very broad coalition of around 30 organizations, 100 investigators from across Australia, many of us coming from universities, but also involving policy decision makers, data providers, indigenous organizations, and health sector organizations. You can see here this beautiful map of Australia that the network is very much organized in communities of practice, which are distributed across the different states and territories. There are at least 8 of them, and they bring together policymakers, researchers, communities, trying to identify the evidence gaps and co-design solutions for improving adaptation to climate change and improving health and well-being. So the aims of the network, as outlined here, is to take leadership in environmental health research, provide the evidence, build capacity and capability, and develop tools which can be used to improve decision making, to protect and improve community health, especially of people and communities which are disproportionately affected by environmental change, strengthen the health system resilience and stability, and reduce inequities and inequalities within and across communities and generations. It's very much an Australian network, but we're increasingly collaborating with other networks, especially in the Asian and Pacific region. And you can see here, in a nutshell, The structure of the network, the overarching themes, indigenous knowledge, data and support systems, and science communication. Many enablers here on the left-hand side, including the focus on solutions, engagement channels with communities and policymakers, and the focus on data integration and visualization. We have a number of themes, 10 themes in the network, and highlighted here the urban health and built environment theme, which is very relevant to this conference. But there are other themes on bushfires, air pollution, food, soil and water security, biosecurity, rural network health, etc. And some of the priority actions here are focusing on bringing together this knowledge about the impacts, about solutions, about interventions, bringing together policymakers and researchers and communities to identify best case action case studies of best practice, and also profiles of different states and territories in terms of environmental impacts and in interventions, and also to provide training opportunities for early career researchers. Just to give you some examples here, so I'm focusing on the urban health and built environment research team, which is led by Professor Xiaoqi here at the UNSW, and also Professor Rebecca Bentley from the University of Melbourne. One of the projects colleagues are currently working on is urban green quality and mental health. So this is led by Xiaoqi Feng with colleagues from CSIRO and the University of Wollongong. And some other work focuses on building capacity and capability, developing a network of early career researchers, providing opportunity for PhD students and for secondments, industrial placements, and training. I'll give you a more specific example of a paper recently published by Professor Rebecca Bentley's team, Dr. Andrew Lee at the University of Melbourne. They looked at the housing damage from climate disasters in Australia in the past 10 years. And as you can see here, they used data from the household income and labor dynamics in Australia survey. 8% of the people were affected by extreme weather events. And you can see here that those living in poor housing conditions took much longer to recover from those disasters, from the exposure to these disasters, compared to people living in high quality housing. So again, this indicates the impact of extreme weather events and climate change in exacerbating inequalities in our society. We published a paper on the floods, building resilience to extreme flooding events in Australia. And as part of that, we developed a framework looking at long-term resilience, not just at a response and a recovery immediately after the extreme events, immediately after the floods, but focusing on strengthening NCD prevention, engaging with communities, and developing plans for regards recovery over the long term, and also improving urban planning to make housing and cities and towns more resilient to extreme events like floods. This is an example of work we did previously in response to the heat wave, in response to the bushfires, the Black Summer bushfires of 2019-2020. This work focused on advice to the general population, but also to specific groups, vulnerable groups, and individuals. We developed fact sheets, different communication tools, podcasts, and those fact sheets were translated into 12 minority languages, aiming to provide this type of advice to culturally and linguistically diverse groups in Australia. Some of the work colleagues at the University Centre for Rural Health in Lismore have carried out focuses on climate change and Aboriginal and Torres Strait Islander health. It's work led by Veronica Matthaios and her team, looking at the impacts of climate change on Indigenous communities, but also looking at the knowledge and wisdom and tradition that they can bring into adaptation and mitigation interventions. Some work we've done recently focused on clean energy and solar microgrids in remote communities, which are often powered by diesel generators. So trying to identify barriers and enablers to promote clean energy in these communities. and we have a pilot project in India. And finally, a couple of examples from the response to the pandemic and the aftermath of the pandemic. A project here led by Professor John Nelson at the University of Sydney, focusing on active travel, how we learn the experience of the pandemic and the active infrastructure, which was promoted at that time to develop long-term solutions, promote active travel, make sure that public transport is to improve the hygiene and reduce the risk of transmission of airborne diseases, airborne infections in public transport, but most importantly, improve active travel and reduce emissions of greenhouse gas and air pollutants. And this is a study again looking at the impact of the pandemic on air quality. A modeling study looking at nitrogen dioxide reductions in all capital cities in Australia before and after before and during the lockdowns. So you can see that there's some significant reduction in some of the cities like Melbourne, Sydney, and Brisbane, comparing before and after the situation before the pandemic and the situation during the lockdowns. And that gives us a snapshot of what can be achieved if these kind of reductions in road traffic could be long-lived and provided a blueprint of what can be achieved in terms of reducing nitrogen dioxide emissions and improving air quality in those cities. So this is a snapshot of some projects within the HIL network. Please visit our website. Now the HIL 2023 conference is open for abstract submissions. Please join the network. You can join as affiliate members. Conference at free of charge. And we have a number of communities of practice across Australia and also a number of research teams, as I mentioned earlier. And it's important to grow this community and bring in not only researchers but also policymakers and community organizations. So here you can see the constellation of the organizations involved in the HIL network. And with this, I would like to thank you for your attention. Hope I didn't take too much time. And please keep in touch with the HIL network. Thank you.
Thank you so much for the presentation, Sotiris. So, some questions.
By the way, we have a session focusing on air quality this afternoon, later this afternoon. Australian stories focusing on air quality management. Melissa and I will host a panel of excellent speakers, specifically focusing on air quality management and intervention in Australia.
Just a question on the setting up of the HIL network. How long have you got funding support for and who's it coming from?
So the funding is from NHMRC. So the core funding is 10 million from NHMRC. It started last year and goes on for 5 years. And the network is very much a platform and launchpad to apply for funding and generate income, research income, and also activities, joint activities with Parts Health, with local authorities, communities, etc. So over the last couple of years, I would say we have generated another 10 million at least of additional funding from a variety of sources.
Okay.
Yes, please.
How do you measure the impact of your activities within this network? Is there a framework for this?
That's a very good question. So in such a large and diverse network, it's important obviously to keep track of what we achieve and make sure that this is as much quantifiable as possible. So we have a KPI framework. We have an independent monitoring evaluation committee, which keeps us on our toes and monitors the activities of the network. So we want to make sure that the activities are well distributed, that there is a good balance in terms of gender, career stage, distribution across Australia, the different topics which are involved in the network, and we monitor all these activities in terms of the distribution of funding, participation in training events, participation in the conference, of course. So There are a number of KPIs which help us track the activities and make sure that we have a equitable distribution of the resources, but also we keep track of the achievements in terms of publication, of course, traditional academic outputs, conference presentations, but also, most important, in terms of impact, respond to consultations, having an input into inquiries, public inquiries, etc.
Yeah, I'm just wondering if you guys are looking at developing some flood risk mapping or heat risk mapping over the whole city, or you have a benchmark that you're looking at, or you're developing it yourself.
So within the network, there are many research groups, and some of these groups will be doing some of this work. I think it's worth saying that many of the researchers in the network come from a public health or environmental public health or epidemiology background, but we have data scientists which work with data, environmental data, and health data, and they are using visualization, data processing visualization techniques, geospatial analysis techniques, looking at different risks in relation to floods, in relation to air quality, in relation to extreme heat, etc. So there are a number of groups which work on extreme events. I would say that the key focus of the network and the starting point was bushfires, extreme heat, droughts. Now, obviously, in the recent years, we had a lot of floods, and addressing this increasing demand for advice in relation to floods. Also, we developed a framework that I showed you earlier on the screen in one of my slides. But in terms of risk flooding and mapping, I'm not fully aware if there is something that's already happening within the network or it's something that we should develop in the future. Thank you.
Thank you.
So moving on to our last presentation today, we have Dr. Nigel Goodman from ANU looking at supporting